The fight against COVID-19 has sent healthcare workers into battle against an enemy they cannot see. Fernando Gonzalez's job is to track that enemy, the virus, down.
The main objective is to protect the individual and public health of our community and our region.
Gonzalez is an epidemiologist with the City of El Paso's Department of Public Health, helping as a contact tracer during the pandemic. He works to uncover where an infection came from and who it might infect next.
We gather the most detailed information on what's happening with that person and who is at risk.
When a new case pops up, investigators contact the person infected. They'll learn as much as they can about their life, who they interact with, and where they've been. The department can then isolate those who may be infected and get them tested.
The tracing is critical, provided that you receive the information in an accurate way.
Dr. Armando Meza is a local infectious disease expert. He says the data helps lead tracers to possible outbreaks before they begin.
Once you know exactly what are the risk factors, then you plan a intervention.
Dr. Meza says on average, someone infected with COVID-19 will spread it to 2 people. That might not sound like a lot, but it can be when each of those people spread it to 2 others. This is just an average. Some people won't infect anyone, others will infect more. Dr. Meza warns of super spreaders who could infect dozens. The tracing can prevent carriers from spreading the virus before they know they have it. The department says workers monitor people who test positive for 14 days and those who came into contact with them and may be at high risk of infection. Gonzalez estimates more than 100 people are now involved in tracing in El Paso, including members of the El Paso Fire Department and medical students at Texas Tech Health Sciences Center.
The staff has been growing accordingly to the number of cases and the intensity of the disease.
One challenge in tracing, a lag in some test results from private labs. A health worker we spoke with who's had COVID-19 and declined to go on camera tells us she did not hear from the health department for days after testing positive.
That call came a week later.
City representatives could not confirm the reason for this patient's delay, but they say it can take several days to hear back from private labs about new cases.
It was a little slow, but once I spoke to somebody, she was very helpful, very present. Talked to me every day. She asked me about my symptoms, asked me how I was feeling, for about a week.
The woman confirmed the department also contacted others she may have exposed.
We offer all the space, all the opportunities for these persons to come to common ground and establish place or site in which they feel comfortable.
The questions can get personal. Will I be able to keep working? How will I keep my family safe?
Nobody wants to go or receive a call or receive a visit from a healthcare professional to tell you that you have a chronic disease or infectious disease.
It's a phone call that can change the life of someone who didn't know they were exposed. But it's a conversation that could ultimately save another.
The story of COVID will be written after the fact. We need to keep in mind is that pandemics are going to come back.
For now, an army of disease detectives is just trying to contain the virus, one interview at a time. Madeline Ottley, ABC 7.